Welcome to a deep dive into anti-infective drugs. You've sent in some nursing school lecture notes and an exam on antibiotics.
Definitely some crucial stuff.
For sure. So let's start breaking it down, starting with the basics.
All right.
The notes define antibiotics as drugs that are used to treat bacterial infections. But there are different ways these drugs can work, right? Like I'm seeing bacteriostatic and bactericidal. What's the difference?
You've hit a key difference there. Bacteriostatic means the antibiotic inhibits bacterial growth, essentially freezing them in place so your immune system can come in and clean up.
Ah, so it's like backup.
Exactly. Bactericidal antibiotics directly kill the bacteria, a more aggressive approach.
So it's like choosing the right tool for the job. And what I find so fascinating is how these antibiotics can target the bacteria without harming our own cells.
It is fascinating. Antibiotics exploit the differences between bacterial and human cells. They work by targeting specific mechanisms essential for bacterial survival, like how their cell walls are built or how they produce proteins.
Gotcha. Human cells work differently, so they're unharmed.
That's what we call selective toxicity.
Clever. Now, the lecture notes mention culturing.
Culturing helps choose the most effective antibiotic.
So it's how we identify the bacteria causing an infection.
Precisely. And this brings us to prophylactic, empiric, and definitive therapy.
Okay, let's break those down.
Prophylactic therapy is when we're trying to prevent infections. Think antibiotics before surgery.
Okay, that makes sense. Empiric therapy.
Empiric therapy is when we start antibiotics before we have culture results back. It's based on the most likely bacteria causing the infection.
Okay, so we're casting a wide net, hoping to catch the right bacteria.
You got it. Definitive therapy comes in once we have those culture results. We can then switch to a more targeted antibiotic, minimizing side effects and helping combat antibiotic resistance.
The notes emphasize checking cultures and referencing efficacy guidelines. Why is that so important for nurses?
Nurses become true guardians of antibiotic stewardship. By making sure the right antibiotic is used for the right infection, they help prevent those superbugs from developing.
Antibiotic resistance. That is a sobering thought. But before we jump into that, let's get into the specific types of antibiotics. The lecture notes list several major classes. Are you ready?
Absolutely. Let's explore those antibiotic all-stars.
All right, let's start with sulfonamides. They're cost-effective and commonly used for things like UTIs, ear infections, and some respiratory infections.
Sulfonamides are definitely workhorses in the antibiotic world.
How do they work?
They're antimetabolites, meaning they disrupt the bacteria's ability to produce folic acid, which is essential for their growth.
Interesting. The notes also warn about sun sensitivity with sulfonamides.
Yes, they can make your skin more sensitive to the sun. What's fascinating is that they share a similar chemical structure with COX-2 inhibitors, a type of pain reliever.
Wow, that's good to know. Now, on to the heavy hitters, the beta-lactams.
Yeah.
Penicillins, cephalosporins, and carbapenems.
The beta-lactams are a force to be reckoned with.
And what's their strategy? How do they work?
They all work by disrupting the formation of the bacterial cell wall, essentially breaking down their defenses.
So would you say they're more bacteriostatic or bactericidal?
They're bactericidal. They actively kill bacteria instead of just inhibiting their growth, which is crucial for currently resolving infections, especially serious ones.
Makes sense. Penicillins seem to be the go-to for a lot of infections.
Yes, they're often the first choice for many infections, particularly those caused by gram-positive bacteria. But allergies to penicillin are relatively common.
Right, so nurses need to be extra cautious. Then we have the cephalosporins, and there are different generations of these.
5 generations. As you go up the generations, they become more potent against gram-negative bacteria and more resistant to breakdown by bacterial enzymes.
So each generation is like an upgrade. And finally, the carbapenems.
Carbapenems are reserved for serious or life-threatening infections. Think of them as the special forces. They have the broadest spectrum of activity.
Okay, makes sense. Saving the most powerful weapons for the toughest opponents. Now, moving on to macrolides. Erythromycin, azithromycin, and clarithromycin, the stars for respiratory infections.
You got it. Macrolides are particularly effective against respiratory infections like pneumonia and bronchitis.
The notes also say erythromycin can help with stomach motility.
That's a great point. Besides its antibiotic properties, erythromycin can stimulate gastric motility, meaning it can help move things along in the digestive system.
It's amazing how one drug can do so much. Okay, next, tetracyclines. They're good for acne, Lyme disease, and some respiratory infections.
Tetracyclines are another group of protein synthesis inhibitors, but there's an important caution here, especially for future nurses.
Deal with that.
They can cause tooth discoloration if taken during childhood or pregnancy.
Got it. Now on to aminoglycosides.
Aminoglycosides are powerful antibiotics, usually reserved for serious gram-negative infections. They also inhibit protein synthesis.
The notes mention gentamicin, streptomycin, and tobramycin, but they also talk about some pretty serious side effects.
Yeah, they can be toxic to the kidneys and inner ear. Careful monitoring is absolutely crucial. Nurses need to keep a close eye on kidney function tests and serum drug levels.
So really important to watch out for those side effects. Okay, last but not least, quinolones. Ciprofloxacin and levofloxacin seem to be the big names here.
Quinolones are broad-spectrum antibiotics. They interfere with bacterial DNA replication.
That sounds pretty effective. Are there any downsides?
Well, they have been linked to some serious side effects, including tendinitis and even tendon rupture.
Yikes. Definitely something to be aware of.
Absolutely. And there are also some potential heart rhythm issues to watch out for.
Okay, so definitely not your everyday antibiotics.
Now, let's not forget our miscellaneous antibiotics. We've got drugs like clindamycin, metronidazole, nitrofurantoin, and the mighty vancomycin.
Ah, yes. Vancomycin, the MRSA slayer.
It targets the bacterial cell wall, just like beta-lactams, but it works differently, allowing it to be effective against those resistant bacteria.
But it's not without its risks, right?
Right. Vancomycin can also cause kidney and ear toxicities, so monitoring is key. And another thing to watch out for is red man syndrome.
Red man syndrome.
It's basically a reaction that causes flushing and a rash on the upper body if the drug is infused too quickly.
Oh, wow. Okay, so what about clindamycin?
Clindamycin is another protein synthesis inhibitor, and it's often used for skin and bone infections. But it carries a risk of pseudomembranous colitis, a severe inflammation of the colon.
That doesn't sound good at all.
Not at all. And it can also interact with other medications, so patient education is very important.
What about metronidazole?
Metronidazole is interesting because it can treat both bacteria and some parasites.
Oh, wow, a double threat.
Yeah. We often use it for infections caused by anaerobic bacteria.
And are there any side effects to watch out for?
Well, it also carries a risk of pseudomembranous colitis, just like clindamycin. And here's a fun fact.
Okay, tell me.
Metronidazole has a disulfiram-like reaction with alcohol. It means if someone drinks alcohol while taking metronidazole, they might experience some pretty unpleasant symptoms.
So no celebratory cocktails with metronidazole.
No, not a good idea. Finally, we have nitrofurantoin, which is mostly used for urinary tract infections.
So it's like a specialist.
Exactly. It concentrates in the urine, making it very effective against the bacteria commonly causing UTIs.
But are there any precautions with nitrofurantoin?
Yes. It should be used cautiously in patients with impaired kidney function. So always make sure to assess kidney function before prescribing it.
Got it. We've covered a lot of information about these antibiotics. It's incredible how diverse they are, each with their own unique strengths and weaknesses.
It really highlights how important it is for nurses to have a deep understanding of these medications.
Now, before we move on to the nursing process in your exam, I want to go back to something mentioned in the lecture notes: antibiotic use in hospitals. It says that a large percentage of hospitalized patients receives antibiotics.
It's estimated that somewhere between 25% and 50% of hospitalized patients receive antibiotics.
Wow, that's a huge number.
It really is. And it shows how important antimicrobial stewardship is, especially in hospitals where the risk of those resistant bacteria spreading is higher.
That brings us to antibiotic resistance,
which is a growing problem worldwide.
Let's dive into that next.
It really is a significant public health threat. And basically what happens is bacteria evolve, and they can survive the effects of antibiotics that used to work against them.
So it's like they're learning to outsmart our weapons.
Exactly. The lecture notes specifically mention MRSA and VRE.
Oh yeah, MRSA, methicillin-resistant Staphylococcus aureus. That one can be really scary. It's resistant to many antibiotics and can lead to serious infections.
And then we've got VRE, vancomycin-resistant enterococcus, another tough one, especially in hospitals.
And the notes mention that MRSA is becoming resistant to practically all antibiotics.
That's definitely a concern, and it shows how urgent it is that we tackle this.
So how do we fight back against these superbugs? The notes mention something called antimicrobial stewardship.
Yeah, that's all about using antibiotics carefully and responsibly. The goal is to keep our existing antibiotics working and to prevent new resistant strains from emerging.
That makes sense. And the notes list a few key strategies like hand washing, proper disinfection, and just using antibiotics appropriately.
Those are definitely the fundamentals. Hand washing is still one of the most effective ways to prevent those infections from spreading.
It's easy to forget how important that is.
It really is. And then, in healthcare settings, proper disinfection is crucial to prevent those resistant organisms from spreading.
And of course, using antibiotics appropriately is super important.
Absolutely. That means only prescribing antibiotics for bacterial infections, not viral infections like the common cold or the flu.
That's a good point, right? Antibiotics won't do anything against a virus.
Exactly. And it's also super important for patients to take the full course of antibiotics, even if they start feeling better before finishing all the pills.
Okay, I've definitely been guilty of that before. Stopping early when I feel better.
I think we all have. But it actually gives the bacteria a chance to come back stronger and become resistant.
Right, it's like we're helping them evolve.
Exactly. So antimicrobial stewardship is a team effort.
Doctors, nurses, pharmacists, and even patients all working together.
Exactly. Everyone has a role to play.
Okay, let's shift gears now and talk about the nursing-specific stuff in the notes. They mentioned something called the nursing process for administering antibiotics.
Oh, yeah. That's a framework that guides nurses to provide safe and effective care, making sure the right medication is given to the right patient at the right dose.
The assessment phase seems pretty thorough. Checking for allergies, kidney function, liver function, reviewing lab results.
It's all about gathering the information we need to make smart decisions about the antibiotics. Like, for example, if a patient has kidney problems, we might have to adjust the dose.
And, of course, getting those cultures before starting the antibiotics.
Absolutely. That's so we know exactly which bacteria we're dealing with.
Now, the implementation phase seems more about giving the medication.
Yeah, we follow something called the 10 rights of medication administration. These are super important for safe medication practice.
And monitoring the IV site is key too, right?
Especially with antibiotics that can be a little rough on the veins.
What about educating the patient?
Oh, that's a huge part of it. Nurses explain to the patients how to take their antibiotics, what side effects to look out for, and why they need to finish the whole course.
The notes also mention teaching patients about superinfections.
Superinfections can happen when those antibiotics disrupt the normal balance of bacteria in the body. This allows other bacteria or fungi to grow too much and cause new infections.
So things like yeast infections.
Exactly. So we need to tell patients what to watch for and when they should see a doctor.
Okay, so the goals of antibiotic therapy seem pretty clear. Get rid of the infection, prevent complications, and stop that antibiotic resistance.
Those are the big ones. And then the evaluation phase is all about making sure the treatment is working.
So that's where we check vital signs, watch for side effects, and make sure the infection is actually getting better.
Exactly. It's an ongoing process to make sure the patient is getting the best possible outcome.
And the lecture notes highlight some interesting stuff about specific antibiotics. Like, for example, it says to infuse vancomycin over at least an hour to prevent red man syndrome.
Right, because giving it too fast can cause that flushing and rash.
And what about metronidazole and alcohol?
Oh yeah, I gotta tell patients to avoid alcohol completely while taking metronidazole and for a bit after they stop taking it.
And the notes say that tetracyclines interact with dairy products and antacids.
Right, those things can stop the tetracyclines from being absorbed properly, so tell your patients to take them at least 2 hours before or 4 hours after those products.
Okay, wow, it seems like there's so much to remember when administering antibiotics.
There really is. That's why it's so important for nurses to be experts on these medications.
All right, before we move on to that nursing exam, let's go over those specific things the notes say about each antibiotic class.
Let's do it. It's all valuable information that nurses can use in practice.
So starting with sulfonamides, anything jump out at you?
Well, the notes say how important it is for patients taking sulfonamides to stay hydrated. It helps prevent crystals from forming in their urine. And taking the pills with food can help with stomach upset.
Right, I remember that. Crystalluria.
Yeah.
Taking them with food makes them easier to tolerate.
Exactly. Now, what about the beta-lactams?
Well, with penicillin, we talked about those allergic reactions. The notes say they happen in up to 4% of treatments.
That's a lot. It just goes to show you how important it is to be on the lookout for those reactions.
Absolutely. And cephalosporins can have that alcohol reaction.
Yeah, and the notes specifically say not to give cephalosporins and aminoglycosides together because of the risk of kidney damage.
Okay, so understanding those drug interactions is key. What about macrolides?
Well, the notes mention that erythromycin is absorbed best on an empty stomach, but taking it with food can help with those stomach side effects.
Always trying to balance things out. Anything else?
Yeah, remember to keep an eye on that heart rate. We need to watch for a prolonged QT interval, which could indicate a problem with the heart rhythm.
Got it. Tetracyclines.
Remember that dairy products, antacids, and iron can interfere with how well they're absorbed. And make sure to warn patients about tooth discoloration, especially for pregnant women and young kids.
Absolutely. Aminoglycosides.
Those peak and trough levels are super important. It's how we make sure the drug is doing its job without causing too many side effects.
Right. We're trying to find that balance between effective treatment and preventing those nasty side effects.
Exactly. And with those quinolones, slow IV infusions are important, and we have to be extra careful with patients who have myasthenia gravis.
Okay, so much to remember. Now, those miscellaneous antibiotics, clindamycin.
Make sure to educate your patients about pseudomembranous colitis and tell them to report any diarrhea right away.
Vancomycin.
Watch those trough levels, give those IV infusions nice and slow, and make sure the patient is hydrated.
It sounds like there are a lot of steps to remember with vancomycin.
There are, but with close monitoring and careful attention, we can use it safely and effectively.
Metronidazole.
Besides that alcohol interaction, keep an eye on liver function in older patients.
And nitrofurantoin.
Don't use it in patients with kidney problems, and tell them to take it with food to prevent an upset stomach.
All right, so it seems like we've covered everything the notes mention about these different antibiotics.
We really have. It just goes to show how important it is for nurses to have a deep understanding of these medications.
All right, I think it's time for that exam. Are you ready?
Absolutely. After this review, we're definitely going to ace it.
Okay, first question. Which of the following factors can influence how well an antibiotic works? Is it A, age, B, genetic factors, C, allergies, or D, all of the above?
It's D, all of the above. Age, genetics, and allergies can all play a role in how someone responds to antibiotics.
Right. Age affects how the body processes drugs. Genetics can impact drug interactions. And allergies, well, we've talked about how serious those can be.
Exactly. It's important for nurses to consider all of these things when they're taking care of patients who are on antibiotics.
Okay, next question. What are sulfonamides mainly used to treat? Is it A, asthma, B, urinary tract infections, C, hypertension, or D, osteoporosis?
The answer is B, urinary tract infections. Sulfonamides are commonly used for UTIs because they work really well against the bacteria that usually cause them.
Okay, next one. How do penicillins work against bacteria? Is it A, they stop RNA synthesis, B, they mess up cell wall synthesis, V, they mess up cell wall synthesis, C, they interfere with metabolic pathways, or D, they prevent protein synthesis?
They mess up cell wall synthesis, that's B. Penicillins weaken the bacterial cell wall, causing the bacteria to burst open.
So they're those bactericidal antibiotics we talked about.
Exactly, they kill the bacteria directly.
Okay, question 4. Which of these statements about aminoglycosides is true? Is it A, they're good against anaerobic bacteria, B, they're usually taken by mouth, C, they can damage the ears and kidneys, or D, they work against all bacteria?
The true statement is C. They can cause ototoxicity and nephrotoxicity, meaning they can damage the ears and kidneys. That's a big one to remember.
Definitely. Monitoring kidney function and hearing is so important. Okay, question 5. What's the correct thing for a nurse to do for a patient taking penicillin? Is it A, give it on an empty stomach, B, watch for allergic reactions, C, check vital signs every hour, or D, tell the patient to take it with dairy?
The most important thing is to watch for allergic reactions, so that's B. Penicillin allergies are pretty common and they can be very serious.
Right, so we need to be ready to act fast. Okay, next question. What's a common side effect of tetracyclines? Is it A, kidney damage, B, teeth discoloration, C, a long QT interval, or D, neutropenia?
It's B, discoloration of teeth. This is especially important for pregnant women and young kids because tetracyclines can stain developing teeth.
So we got to educate our patients about this side effect.
Absolutely, especially for those groups.
Okay, next question. Which antibiotic is typically used to treat MRSA? Is it A, vancomycin, B, amoxicillin, C, erythromycin, or D, ciprofloxacin?
The answer is A, vancomycin. It's a heavy hitter and often used when other antibiotics don't work against MRSA.
Okay, next question. True or false? Fluoroquinolones can be given to kids without any risk.
That's false. Fluoroquinolones aren't usually recommended for kids because they can cause problems with their muscles and tendons.
Yeah, and it can cause other issues too, so they're not a great choice for kids. Okay, next one. When a nurse is teaching a patient about metronidazole, what should they include? Is it A, avoid dairy, B, it's fine to drink alcohol, C, report any weakness or fatigue, or D, it works against all types of infections?
The answer is C, report any weakness or unusual fatigue. Those could be signs of something more serious.
So it's important to make sure the patient knows what to look out for.
Absolutely. Catching those things early is really important.
Okay, next. How do macrolides work? Is it A, they stop protein synthesis, B, they stop folic acid synthesis, C, they change DNA replication, or D, they stop cell wall synthesis?
The answer is A, disruption of protein synthesis. They mess with the bacteria's ability to make proteins, which are essential for them to grow.
Right, so they're those bacteriostatic antibiotics we talked about.
Exactly. They stop the bacteria from growing, and then the body's immune system can do its job.
Okay, this is a select all that apply question. Which of these things can help prevent superinfections when a patient is on antibiotics? A, hand washing. B, taking all of the antibiotics as prescribed. C, using antiseptics a lot. Or D, avoiding other sick people.
The right answers are A, hand washing, and B, taking the entire course of antibiotics. Hand washing helps stop the spread of germs, and taking all the antibiotics makes sure the bacteria are completely gone, which reduces the risk of resistance and superinfection.
So using antiseptics a lot might not be the best idea.
Right. Using them too much can actually disrupt the balance of good bacteria on the skin.
Okay, makes sense. And avoiding sick people, well, that's good advice in general.
Definitely.
Oh.
But the focus should really be on hand washing and taking the full course of those antibiotics.
Next question. When should clindamycin not be used? Is it A, when someone is allergic to lincomycin, B, when someone has urticaria, C, when someone has osteoporosis, or D, when someone has ulcerative colitis?
The answer is A, a known allergy to lincomycin. Clindamycin is similar to lincomycin, so if someone is allergic to one, they'll likely be allergic to the other.
Okay, so always double check those allergies.
Absolutely. Always.
True or false? The main goal of antibiotic therapy is to kill every single bacteria in the body.
That's false. We're actually trying to lower the amount of bacteria to a level that the body can handle on its own. We don't want to wipe them all out.
Right. That could actually cause more problems by disrupting the balance of bacteria in the body.
Exactly.
Okay, another one. What's a potential side effect of carbapenems? A, anemia, B, seizures, C, photosensitivity, or D, hematuria?
It's B, seizures. Carbapenems can make someone more likely to have a seizure, especially if they have a history of seizures.
So we need to be on the lookout for any signs of seizures.
Absolutely. Okay, here's a scenario. What's the nurse's responsibility if they get a computer-generated order for an antibiotic? Is it A, ignore patient allergies, B, double-check the medication en route, C, give the medication without checking labs, or D, ignore drug interactions? Definitely B. Double-check the medication names and routes. Even though the order came from a computer, it's still important for the nurse to double-check everything to make sure it's safe.
It's like that final safety check.
Exactly. Okay, what antibiotic is the best choice for anaerobic bacteria? Is it A, gentamicin, B, metronidazole, C, amoxicillin, or D, tetracycline? The best choice for anaerobic bacteria is B, metronidazole. It works against both anaerobic bacteria and some parasites.
Right, so it's perfect for those infections where oxygen isn't present.
Exactly. Okay, another select all that apply question. Which of these could be signs of an allergic reaction to an antibiotic? A, hives, B, nausea, C, trouble breathing, or D, rash? The correct answers are A, hives, C, difficulty breathing, and D, rash. These are all classic signs of an allergic reaction.
So nausea could be a side effect, but it's not as clear of a sign of an allergic reaction as those others.
Right. Okay, what should nurses keep an eye on for a patient taking aminoglycosides? A, kidney function, B, hearing, C, potassium levels, or D, blood sugar? A, kidney function, and B, hearing ability. Aminoglycosides can be hard on the kidneys and ears.
Okay, so monitoring is crucial. Another select all that apply question. When should tetracycline absolutely not be used?
Yeah.
A, pregnancy, B, kids under 8, C, penicillin allergy, or D, kidney failure?
The answers are A, pregnancy, and B, children under 8 years. In these cases, the risks are too high, so tetracycline shouldn't be used.
Okay, so those are absolute no-nos. What about kidney failure?
We should use it carefully in those cases, but it's not a complete contraindication. And the penicillin allergy doesn't matter because tetracyclines are completely different.
All right, good point. Okay, last select all that apply. To help prevent antibiotic resistance, nurses should do which of these? A, only give antibiotics when they're really needed. B, teach patients to finish their antibiotics. C, prescribe antibiotics to their friends and family. Or D, encourage good hand hygiene.
The right answers are A, administer antibiotics only when necessary, B, educate patients on completing their full course of antibiotics, and D, encourage proper hand hygiene. These are all ways to be responsible with antibiotics and prevent resistance.
So definitely don't prescribe antibiotics to friends and family.
Absolutely not. That's dangerous and unethical.
Okay, some true or false questions now. True or false? Taking tetracycline with calcium-rich foods can affect how much of the drug gets absorbed.
That's true. Calcium can bind to tetracycline and make it harder for the body to absorb.
So timing those doses is important.
Definitely. Okay, true or false? Vancomycin is the first choice for urinary tract infections. That's false. Vancomycin is a powerful antibiotic, and we try to save it for serious infections. We don't usually use it for simple UTIs.
Right, we want to save the big guns for when we really need them.
Exactly. Okay, true or false? Patients taking fluoroquinolones should stay out of the sun. That's true. Fluoroquinolones can make the skin really sensitive to sunlight, so patients need to be careful.
Okay, so tell them to wear sunscreen and protective clothing.
Definitely. Next one. True or false? We should use carbapenems for mild infections to prevent resistance. False. Carbapenems are for serious infections, not mild ones. Using them for minor things would just make the resistance problem worse.
Right, it's about choosing the right antibiotic for the right infection.
Exactly. Last one. True or false? Nitrofurantoin is safe to use in patients who have really bad kidneys. That's false. Nitrofurantoin can actually build up in the body and become toxic if the kidneys aren't working well.
So checking kidney function is crucial.
Absolutely. Okay, I think we made it through the whole exam. That was a great review of antibiotics.
Yeah, I think our future nurse is ready for their tests.
For sure. We covered all the important stuff, how they work, their side effects, what nurses need to know, and even aced that exam.
And we talked about how important antimicrobial stewardship is.
Yes, and how everyone has a role to play.
Now, before we move on, I want to go back to that statistic we discussed. About a quarter to a half of hospitalized patients get antibiotics.
Yeah, it's a huge number that really makes you think about antibiotic resistance.
It makes you wonder how we can use antibiotics better in hospitals to stop resistance while still treating patients effectively.
Absolutely. That's something to think about.
And that brings us to the last part of our deep dive. We'll be exploring those nursing implications even more and finish with a thought-provoking question for our listeners.
I'm looking forward to it.
Okay, so we've explored all these different antibiotics, their mechanisms, side effects, even tackled that practice exam.
And we've really highlighted how crucial the role of a nurse is in making sure these medications are used safely and effectively.
Absolutely. But before we wrap things up, I want to touch on that statistic we mentioned, the one about how many patients in hospitals are on antibiotics.
Yeah, that 25–50% of hospitalized patients getting antibiotics. It's a big number.
It really is, and it makes you think about the potential impact on antibiotic resistance.
Yeah.
Especially in a setting like a hospital.
Absolutely. And those nursing lecture notes you shared had some really good points about considerations for each class of antibiotic.
They did. And those are like gold for nurses, right? Things they need to keep in mind when they're giving these meds and teaching patients.
Absolutely. Those little details can make a big difference.
So let's go through some of those nursing pearls of wisdom, starting with sulfonamides. Anything come to mind?
Well, the notes really emphasize keeping patients hydrated. It helps prevent those crystals from forming in the urine.
Right. Crystalluria. That's important.
And taking those pills with food can help with stomach upset.
Makes sense. Okay, now on to the beta-lactams. With penicillins, we talked about the risk of allergic reactions.
Oh, yeah. Those are important to watch out for. And the notes say that reactions can happen in up to 4% of treatments. That's a lot.
It really shows how even common meds can have some serious risks. Nurses need to be on the lookout and know what to do if a reaction happens.
Absolutely. Early intervention can be crucial. And with cephalosporins, remember that potential reaction with alcohol.
Yeah, not a good combination.
Definitely not. And remember, the notes say not to give cephalosporins and aminoglycosides too close together. It increases the risk of kidney problems.
That's a good example of why those drug interactions are so important to understand.
Right. We want to prevent those complications.
Yeah.
Okay, moving on to macrolides. Erythromycin is best absorbed on an empty stomach, but food can help with the stomach upset.
So finding that balance is key. Any other macrolide considerations?
Yeah. We always need to monitor the heart, specifically looking for a prolonged QT interval. It could mean a problem with the heart rhythm.
Okay, good to know. What about tetracyclines?
Always remember that dairy, antacids, and iron supplements can interfere with how well they're absorbed. And of course, educate patients about the risk of teeth discoloration, especially in kids and pregnant women.
Definitely important to warn them about that. What about aminoglycosides? I remember the notes talking about monitoring those peak and trough levels.
Those are really important. They help us make sure the drug is doing its job without causing those scary side effects like kidney damage and hearing problems.
Right, so we're checking those levels to find that sweet spot where the drug is working but not harming the patient.
Exactly. And speaking of needing to be careful, those quinolones need slow 5e infusions, and we need to be extra cautious with patients who have myasthenia gravis.
So many things to keep track of. Okay, now on to those miscellaneous antibiotics. What about clindamycin?
With clindamycin, we need to teach patients about the risk of pseudomembranous colitis. They need to tell us right away if they experience any diarrhea.
And vancomycin.
Vancomycin. Watch those trough levels, make sure those IV infusions are given slowly, and keep the patient well hydrated.
It sounds like there's a lot involved with giving vancomycin.
There is, but those steps help make sure it's given safely and effectively.
Now, metronidazole. Anything else besides avoiding alcohol?
For older patients, it's important to keep an eye on their liver function tests.
Okay, good to know. And finally, nitrofurantoin. Any tips?
Make sure their kidneys are working okay before giving them nitrofurantoin, and remind them to take it with food to avoid stomach upset.
Wow, we've gone over so much. Those lecture notes were packed with useful information for nurses.
They really were. It just shows how complex antibiotic therapy can be. And it highlights just how critical nurses are in making sure these powerful meds are given correctly.
Absolutely. We've really done a deep dive into the world of antibiotics. We've looked at how they work, their potential side effects, tackled that nursing exam, and even discussed some of the finer points of administering them.
I think our listeners are well equipped to handle anything their nursing school throws at them.
I agree. And we've really emphasized how important antimicrobial stewardship is and how everyone plays a role in preserving the effectiveness of these life-saving drugs.
Definitely a team effort.
But before we finish, I want to leave our listeners with one final thought. We've talked about how many people in hospitals are on antibiotics. A huge number, right?
It is.
And it makes you think, what impact does all that antibiotic use have on the development of resistance?
It's something we all need to consider, and it shows how important continued research and new discoveries are in the fight against infections.
And on that note, we'll wrap up this deep dive. We hope you've enjoyed exploring the world of antibiotics with us. Keep those brains engaged, and until next time, happy learning.